Hello and welcome. You're watching the Health Talk session by Yashoda Hospitals. When your kidneys fail, treatment is needed to replace the work your own kidneys can no longer do. So let's discuss about kidney transplant in our today's episode. I'm Dr. Lakshmi, and joining us today we have with us Dr. Dilip Babu, consultant nephrologist from Yashoda Hospitals, Somajiguda. Welcome to the program, doctor.
Hello, good morning.
So doctor, kidney disease remains a huge burden on the society, and about roughly 10% of adult population suffer with kidney disease at some point or the other. So in general, doctor, what are the causes for renal failure?
Yeah, as you said correctly, the incidence and prevalence of chronic kidney disease is increasing day by day. So main cause for chronic kidney disease is uncontrolled sugars in diabetic patients and high blood pressure. Apart from these two causes, now we are finding younger generation with chronic kidney disease, and the main reason for these people, younger people having chronic kidney disease, is due to chronic glomerulonephritis, predominantly IgA nephropathy, and some of the genetic disease like polycystic kidney disease, which is one of the genetic cause for chronic kidney disease in younger population. So these are the main causes.
So someone suffering with chronic kidney disease, what are the treatment options available?
Yeah, so once any patient diagnosed with the chronic kidney disease, what we call as previously used to call as chronic renal failure or permanent kidney damage, then they will have two treatment options. Initially, we try to treat with medications to prolong the stage of dialysis, but once they progress to a stage of dialysis, they will have two options. Either they have to go for dialysis weekly thrice rest of their life, or another option is a kidney transplant. If anyone from the family member is willing to donate the kidney, he can donate the kidney to the patient, and that we can plan for that patient kidney transplant. So out of these two options, kidney transplant is the best available option for these patients, as it causes better survival and better quality of life in these patients.
So you've mentioned that there are two types of treatment, that is dialysis and transplant. So how do they differ from each other, and what are the advantages of each of them?
Yeah, once they diagnose with the chronic kidney disease, which is in advanced stage, we call it as end stage renal disease. These people will have two options. They have to continue on dialysis, or they will have option of kidney transplant. Compared to these two modalities, kidney transplant is always have the better quality of life, better survival rate as compared to the dialysis. In fact, after transplant, they can travel, they will have relatively less dietary restrictions and less number of medications after the kidney transplant. So kidney transplant is always better option for these patients.
So doctor, if we have to talk about kidney transplant, how is it done and where exactly is it done?
So we at Yashoda Hospitals, Somajiguda, we are regularly doing kidney transplants. So the person once decided to go ahead with the kidney transplant, we screen the donors from their family members. If no one from the family member is available for donation, then we will register their name in Jeevan Daan program, which is a deceased donor registration program, where they will be kept in the waiting list for the kidney transplant. So if any family member who is having the same blood group, he can donate the kidney. We will screen both the donor as well as the recipient and plan for kidney transplant.
In general, doctor, there's a perception among the general public that kidney transplant is not safe and life after kidney transplant is going to be difficult. So what do you have to say about this?
As per all the research data, the 10-year survival for the patients who are on dialysis is only 40%. Compared to the 10-year survival, those who undergo kidney transplant is almost 80%. So quality of life as well as the survival after kidney transplant is much better compared to the dialysis. Main concern people will have about donation is if their family member donates the kidney, what will happen to the donor in the future. So usually kidney donation is surgically as well as the medically is quite safe procedure. The people can donate their kidney. With one kidney they will live their normal life. So there is lot of apprehension about kidney donation, but relatively, scientifically speaking, kidney donation is quite safe.
So, doctor, if one decides to go ahead with kidney transplant, there are a lot of questions around this topic, like as to who can donate a kidney, and is it always from the same family, and how is life going to be after kidney transplant? So, how would you like to address these issues?
So, if some patient decides about kidney transplant, we usually counsel the donors like family members, all the primary first degree or second degree family members, and we counsel them for the donation, and we will do all the necessary investigations in both the donor as well as the recipient. We rule out all other medical illnesses in the donors so that they should not have any problem after kidney donation. And we will tell them after kidney donation they can live the normal life with single kidney. As we all know, a lot of people by birth they have single kidney. So, kidney donation is quite safe. Although after donation we tell them for regular checkup every yearly, and they will have normal life, they can do all the physical activities, they can do the hard work after kidney donation. So, kidney donation is relatively safe.
So, once the renal transplant is done, doctor, how is the recovery period is going to be, and what kind of complications can one expect and be prepared for?
So, kidney transplant, both the donor as well as the recipient is admitted one day before the surgery, and we don't remove the original damaged kidneys from the recipient. In fact, we put a new kidney in the lower part of their abdomen where all the blood vessels and ureter is connected with the recipient, and the donor kidney will be removed by laparoscopic technique, which is relatively safe and which will have shorter hospital stay. Donor will be discharged within 3 days. But after the kidney is surgery, transplant surgery is done, patient has to take regular immunosuppressions, and we give some medications and injections before the transplant so that that kidney will be accepted by the recipient. And usually after 7 days recipient will be discharged and they will be regularly followed up. Recipient has to take regular immunosuppressions, few medications for their new kidney to function better for the rest of the life.
So, how do you think life after kidney transplant is going to be, and what are the concerns or complications one can expect?
Once we decide about kidney transplant, the recipient will have concerns whether this new kidney will work or whether it will be accepted by the body or not. So, usually with newer lines of medications and newer immunosuppressive medications, the chances of rejection is very less. In fact, we have 95% success rate. There are few chances of rejection, less than 5% after the kidney transplant, but most of those rejections which will be diagnosed early and which can be reversed. Another two issues, what will happen to the recipient is risk of infections. So, these people after kidney transplant, they have to be careful because they are already on immunosuppressive medications. So, chances of infection will be high. In very rare cases, the same kidney, it's the same reason which has caused the damage to the native kidneys, the same reason might damage to the transplanted kidney. So, these are the few concerns about the recipients.
It's now time to bust few myths and know the facts. Taking the first one. Kidney transplant is an expensive procedure than dialysis.
Yeah, this is one of the perception by the patients that kidney transplant is very costly procedure. But compared to dialysis, in dialysis patients, the patient spend a lot of money for their dialysis, for the lot of BP medications, lot of iron and erythropoietin medications. They spend for their AV fistula surgeries. In fact, those people who are doing dialysis, most of those patients do weekly, twice dialysis. Ideally, it is recommended is thrice week dialysis. Because of this inadequate dialysis, they will get recurrent admissions in the hospitals, ICU. So, overall, if you calculate, they spend more money. Every monthly approximately they spend 40 to 50,000 and rest of their life, plus their quality of life also goes down. So, this is the cost they spend compared to transplant where they spend one time money and rest of the life they have to take some medication, but monthly cost will come down approximately 6 to 7,000 per month, and they have better quality of life as well as the better survival. So, cost wise kidney transplant is much cheaper compared to the dialysis.
Taking the next one, kidney transplant should be the last resort to consider.
Yeah, if the patient have the option of donor, or if they don't have donor, no one of their family member is willing or fit for donation, so they will have option to get them registered in Jeevan Daan program, which is Telangana government's disease donor registration program. If they get registered in Jeevan Daan program, they will be put on waiting list, and we are doing a lot of cadaver, that is deceased donor transplant. So once their number comes, we can do the deceased donor transplant, and they will be as good. Results of deceased donor kidney transplantation is equally good compared to living donation. Another thing is those people who wants to donate, but their blood group is not matching. So we are doing kidney transplant against the blood group also. If still we have another recently started program of kidney pair donation, where donor and recipient, because of their blood group is not matching, so we can swap the kidneys from one recipient might get the donor from another couple, and this recipient might get the same blood group donor from another couple. So this kidney pair donation is a new thing where we can exchange the kidneys among the two people, and which will increase the kidney transplantation rate.
Taking the next one, kidney transplant fails most of the time and the success rate is very less.
As I told, kidney transplant success rate is, with current available newer immunosuppressive medication, is 95%. We have a failure rate only in 5% or less than 5%. The main reason for failure is rejections, infections, and recurrence of the original disease in the transplanted kidney. But the concern, comparatively to the dialysis, the success rate is almost 95 to 96%. So kidney transplant is always the best available option for these patients.
So before ending this episode, doctor, what message you would like to give to our audience out there?
My message will be all patients who are having chronic kidney disease, in some time in their future they might require a dialysis or kidney transplant. We should prepare them kidney transplant early. When we know the patient is having chronic kidney disease, they should plan their kidney transplant in advance, with screening of the family members for donations. If family member is not willing, we should register them on the Jeevan Daan program or kidney pair donation program, because out of these two options, as I said, kidney transplant is the best treatment option, and which is less expensive compared to the dialysis, and better quality of life and better survival. Thank you.
So thank you, doctor. It was wonderful talking to you.
Thank you.
So this brings us to the end of this episode. Hope this episode was informative on the topic kidney transplant. And don't forget to join us for the next week as well. Until then, take care and stay healthy. Thank you.